Good afternoon again. It's nice to see you. We're here today to talk a little bit about some special part that you need to be concerned about when you are evaluating a patient's skin and when you're writing in the narrative the things that you find. According to the Mayo Clinic, skin cancer is an abnormal growth of skin cells. It's skin cells that have gone on a vacation and decided to get fat and happy. Not good. Skin cancer most often develops in areas of the skin that are exposed to the sun. However, that's not always true because there are types of skin cancer which occur in areas that are not sun exposed. So you can't assume anything. You have to look over the entire skin. There are three main kinds of skin cancer that we look for. One is basal cell carcinoma. It's most common in fair-skinned people, and it occurs more often than not in areas that are in fact exposed to sun. The nice part about basal cell carcinoma, if there is a nice thing about it, is that basal cell carcinoma tends to be very, very slow growing. Doesn't usually cause metastases, which are spreading of that particular cancer. Squamous cell carcinoma develops in a different layer of the skin. It's most common in darker skinned individuals in areas that are not exposed to sun. So areas like under the shirt or under the trousers, you've got to take a look there as you're evaluating and assessing your patient. The skin cancer that most people are concerned about and that most have heard about is melanoma. Melanoma is rare in people with dark skin. It's the 5th most common cancer in men and the 6th most common cancer in women. And the majority of the patients that are diagnosed with melanoma are white males that are over the age of 50. If you think about it, where would be the most common places that you would find melanoma? Those areas that are most often exposed to the sun, like the tips of the ears and the back of the neck. If you think about it, most men, they wear those ball caps, and the parts that are exposed, not their face, but those parts that are more likely to develop the melanoma. There are a number of risk factors that when you're talking to your patient and you're writing down the notes that you need to be paying attention to. Sunlight, sun exposure is a huge risk factor. You need to make sure when you're talking to your patients that you're telling them about the using of some type of sunscreen anytime that they are out in the sun. While it is important that we get 15 to 30 minutes of unprotected sun exposure every day to make enough vitamin D to run our system, any more than that, we are at risk of developing cancer of some sort. Another risk factor are those individuals who have blistered sunburns at some time in their past. If a person is very prone to sunburn, if they freckle a lot when they get out in the sun, these folks are at high risk of developing melanoma or some type of skin cancer. But it's not just a lot of exposure in a short amount of time. This exposure is cumulative. Damage can be done over time. I saw a picture on the internet not too very long ago of a gentleman who's a truck driver. Long years of driving truck with one side of his body exposed to the sun out the driver's side window. And if you were to look at his face, one side looked like a 50 to 60-ish year old man. The other side looked like he had been mummified. The damage to his arm and to his face was so significant from the long years of exposure as he drove truck. Consider that. as you go about your business. And for those of you who are sun worshipers, those fair-haired children who like to be golden brown all the time, realize that tanning, while you're young, it may make you look glorious, but by the time you're 40, that accumulated exposure to the ultraviolet rays will allow you to look like one of the raisin people. This sun exposure causes damage to the collagen. It causes your skin to become lax and wrinkled, and it literally turns your skin to leather. So you might want to consider limiting your time in the tanning beds. Now, the Skin Cancer Foundation has these statistics. They say that indoor ultraviolet tanners are 74% more likely to develop melanoma than those who have never tanned indoors. And those who begin tanning before the age of 35 increase their melanoma risk to 87%. So whether you're a sun worshiper and you love that golden brown, or you're talking to a patient who is, consider those statistics as you teach them about protecting their skin. As you look at them and as you teach them, tell them to look for anything that's new, a new mole, or a mole that has changed, a patch on their skin that's red or flaky or darker color than the rest of their skin. If they get a new kind of flesh-colored lump, it's a concern. And if they've got a mole, and many of us do, watch those moles carefully. If they change in size or shape or color, that's a concern, and that mole should be evaluated, okay? And the last thing that you really need to pay attention to is if the patient has a sore that won't heal. Skin that's damaged, skin that is cancerous, will frequently have difficulty renewing itself. So, watch for any changes, anything that's new. We use a mnemonic to help remember the things that should ring a bell when we're evaluating an area for melanoma. We try to make it as easy as possible, so we're going to use the alphabet. ABCD of malignant melanoma. Think about these as you're evaluating these moles or these lesions. Is it asymmetrical? Most skin lesions will take on some semblance of symmetry, round or oval, but these are odd-shaped. Look at the borders. Are the borders jagged or ragged or not very distinct? As you look at it, can you not really tell where the lesion starts and where it stops? The edges are so blurred. Look at the color. Normal lesions are fairly uniform in color across the body. But if you've got a lesion that has changed color, that is variegated in color, or that is multicolored, tan to black, and in some cases you may have areas of redness or even blue in the lesion. A multicolored lesion it needs to be evaluated. And the third thing has to do with size. The diameter of a lesion that is suspect should be no more than 6 millimeters in size. Anything larger than 6 millimeters is a concern. Well, you may be thinking, well, I don't carry a tape measure around. How am I supposed to know what 6 millimeters is? But you do have something that you can use. If you think about the size of a pencil eraser on a number 2 pencil, that's approximately 6 millimeters. Any lesion that is larger than that should be evaluated by a professional. As you talk to your patients and as you write these things down, use the ABCD to help you organize your thoughts and to document appropriately so that you can do good things for your patients. May the Lord bless you as you go about your business, and have a great day.